The Biden administration has taken the first steps to revoke work requirements in state Medicaid programs. States have received a letter saying they will not be allowed to add work to their Medicaid program. In fact, the Biden administration calls it unacceptable to condition the receipt of Medicaid benefits on an individual's ability to work. This is the opposite perspective of the Trump administration, which actually encouraged states to add what they called community engagement initiatives to their Medicaid program. And this was done through what was called demonstration waivers, Section 1115 demonstration waivers to the federal government, saying that they could do Medicaid better than what federal law required. And in so doing, they added these conditions of working to receive your benefits. The Biden administration said that's not how Medicaid works. That's not promoting the initiative and the objective of Medicaid by adding a work requirement, and is therefore trying to remove them from the books. Now, for states that already had approved waivers, states that already were approved to let people work to get their Medicaid, they also got a letter from the Biden administration saying that, first of all, the COVID pandemic has made work requirements infeasible. They actually point to the Families First Coronavirus Response Act that says if you're getting an enhanced federal share for your Medicaid program, if you're getting more federal money, you can't add things like work requirement to your Medicaid programs right now. To do so would be to limit the number of people that could take advantage of Medicaid, and potentially people could drop off the program. And you can't do that if you're getting the enhanced federal share. It also says that CMS, the Centers for Medicare and Medicaid Services, is reviewing all of the existing waivers that include a work requirement piece. But those waivers might include other provisions. All of that is up for review, and states are on notice that that is happening. States actually have 30 days to contest this review and defend why they want to keep work requirements on the books. Now, CMS, the Centers for Medicare and Medicaid Services, is sending these letters to states despite a Trump requirement that directed states to keep their waivers unchanged for 9 months. This was one of the last actions by Trump administration officials before they left office. Some see it as an 11th hour attempt to try to keep the new Biden administration from making changes to work requirements like the ones that are just being proposed. The Biden administration was not deterred. They said the Trump requirement did not take the need for flexibility in the time of COVID into account, and it is therefore moving forward with these letters telling states they should not be conditioning Medicaid on the ability to work. Now, it was about 12 states that had moved forward with policy changes that included work requirements over the last couple years, 2 to 3 years. And of course, litigation followed, and it's made its way all the way up to the U.S. Supreme Court. States like Arkansas, New Hampshire, and Kentucky have been getting the most attention as they've moved through the federal courts. Arkansas and New Hampshire's case goes before the U.S. Supreme Court at the end of March 29th. Other states halted their policy change when COVID hit. Other states halted their policy change when they changed governors, when the political party in charge of the state changed. Moving forward, there are a couple of dates to keep in mind. First of all, like we said, states have 30 days to contest the intent to withdraw the waiver that the Centers for Medicare and Medicaid Services and the Biden administration has proposed. That Supreme Court case is March 29th, and in theory, President Biden's plans to withdraw work rules could make that Supreme Court case moot. It could take it completely off the books. Letters to the states, we link to those in the description below. Both that first letter saying the intent to revoke, and a second letter saying that the feds absolutely have the right to do this and not wait those 9 months like the Trump administration had outlined. You can also read the executive order, which gives the Biden administration the authority to move forward on this. It's part of the Strengthening Medicaid and the Affordable Care Act executive order. We have a separate video on the Affordable Care Act piece of that executive order. That's the piece that opens up healthcare.gov, the federal marketplace, for additional open enrollment.